Dr. Das, we get many calls from patients struggling with ropey, unsightly veins, throbbing pain, swelling, and heavy, tired legs. Millions of people suffer from venous insufficiency. What can you tell us that will help our patients understand?
Well, let me begin by showing this in a picture format where the problem in those people who have varicose veins. Looking at this picture, you see there are two predominant colors. One is a blue and another is a purple. The blue is a superficial vein, the purple is a deep vein, and they rise from the ankle and foot all the way to our groin at number 4, if you see it here, and they meet to make one large vein and go into our abdomen. And from the other side, the similar things happen and they join together to make the largest vein, which goes to our heart, draining the blood. The blood flow in the vein is upwards towards the heart, and here is the cut section of a vein which demonstrates that fact. It shows that the arrows are pointing upwards, directing the blood flow upwards. And in the second picture, if you see the arrows are pointing down, what happens when Earth's gravity pulls the blood down in a standing or sitting leg? The blood is pulled down, but a competent valve doesn't allow that to go down. It closes and the blood stays up and blood cannot flow down. But here is somebody whose valve is defective, and if you see, it's not closing as good as this, and there's a central hole through which the blood is flowing down, causing the varicosities of the vein. And that vein happens to be the blue vein. The blood rises in the purple, rises in the blue, and reaching number 4, the blood falls down in the blue vein. So the treatments are designed around this physiology to prevent the blood coming down. 10 years ago, all of these people went to hospital, have a long 3-hour surgery and a prolonged recovery, but with the advent of new technology, now we can do these procedures in the privacy of our offices, and what we do then is close the blue vein, which is draining back the open. Here the floodgate is open and we try to close that. And how do we do it? We do it by passing either a laser fiber or a radio frequency fiber through this vein around the knee, go near about the junction to number 4, and then we start the process with the laser energy or radio frequency energy, which in turn closes the vein. We slowly pull the catheter out and come out through the point of entrance. And by the time we come out, the entire vein is closed. So what happens? The blood was rising here and falling back in the blue vein. Now it doesn't have a channel to fall back, so it is forced to go up. So before this, a person used to have half a liter of blood sitting in the calf, which causes aches, pains, and subsequent ulcers. Now the blood is able to flow back to our heart. So there are 2 procedures which are designed. One is with the laser and other with the radio frequency wave. And in our vein center, we perform both procedures depending upon the need of a person. The third procedure, which is needed at times, is called multiple stab phlebectomy or microsurgery. In that procedure, what we do, some of the local veins which have no direct continuation to the main vein are taken out later in the process of treatment by a very fine microsurgery, leaving minimal scars and good cosmetic results. So the satisfaction from the surgery and restoration of the leg to its normal or prior to varicose vein status is excellent. If you see here, there is a green vein, number 8, joining the purple and blue, and the blood usually flows from blue to purple, but in some of us it is defective and blood flows back to give rise to varicose veins. For this, we have two forms of treatment. One is called ultrasound guided sclerotherapy, and the other one again is known as microsurgery. So this little vein, we try to close it one way or the other, reversing the process so that blood can flow upwards. So these are the procedures which are done in the office setting with complete privacy and return to work in no time. This is the modern treatment of varicose veins.
Okay. Are the procedures that are done in the office covered by insurance?
The answer is yes. Office and in the hospital, as long as the surgeon who is doing, he participates in the insurance.
Will the procedure hurt? And if it does, which part of it hurts?
During the procedure, there is minimal discomfort because the vein and the skin is anesthetized with local local injection of lidocaine or xylocaine. Post-operatively, there is some minimal discomfort. Some people have none, but some people have degrees of pain and discomfort, but most of them subside at the end of 2 weeks and doesn't need too much of pain medication. In my practice, doing thousands of these procedures, we have hardly given any narcotics for these people. We just give them ibuprofen or Tylenol for their discomfort.
Will there be any restrictions to my activities? And how long will they be in place?
The person having this major form of laser surgery is advised to use a compression stockings for about 2 weeks, at the end of which he or she can remove the stockings and return to her normal self. We restrict the very active work or very strenuous work or very fast aerobic exercises for 2 to 3 weeks. The people doing desk work can return in about 2 to 3 days, and people doing heavy manual work may have to wait for about 2 weeks before returning to the work.